Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources. Welcome to today's edition of Helping Seniors Television from the Helping Seniors Network. Whether you are caring for a senior, are a senior, or just plan to be one, we hope you'll enjoy today's program. Macular degeneration has certainly been known as a vision killer, and yet thanks to enormous advances in technology and understanding, there is great hope when macular degeneration is diagnosed early. Dr. Hetal Vaishnav of the Eye Institute updates on the latest advances for maintaining vision even with a diagnosis of macular degeneration. I'm Kerry Fink with Helping Seniors TV. Welcome to today's show. It's such a pleasure having you with us, and really excited to talk about today's topic. There's really something to offer a lot of hope, and today's topic is macular degeneration updates, and really pleased to have with us a foremost authority on this topic, Dr. Vaishnav from the Eye Institute. Welcome.
Thank you for having me.
Yeah, and if you go to the Helping Seniors website, you will see that Joe Steckler, who's our president and founder, and I have the privilege of sitting in for today, you guys have done many shows over the years where you've covered a lot of different vision-related topics, including macular degeneration. There's a great discussion of what it is. It explains the difference between wet and dry. And we were actually having the conversation before we rolled the cameras. I said, is that information valid for our viewers? Because we find viewers get on the website, they look up by topic, they say, here's what I want to know about, and they'll watch these videos, and even though they may have been done a year or so back, they still good information. And you said it's really that, and the opportunities are even better now than they were even a few years ago for getting some help and some relief and some moving in the right direction. So we're going to title today's program Macular Degeneration Updates. And so for that, maybe the place we need to begin is if somebody's just run across that word, maybe it's come up in their family someplace. What is macular degeneration? Let's just start with getting the summary of that onto the table.
Great question. So macular degeneration is a neurodegenerative disease of the retina. So our eye, the back of our eye is, if you imagine the eye as a camera, the front of the eye where glasses are and your cornea is, that's the lens of the eye. Then the back of the eye, the film of that camera would be the retina. And the retina is part of the brain. It's an amazing structure and it creates vision, as we know. And so macular degeneration affects that part of the eye called the macula. And the macula is the very center of our retina where our good reading central vision is created. And macular degeneration is a genetically acquired condition where the cells of the retina in the center degenerate. And as a result, people start to lose their central vision. They never lose their side vision, which is the silver lining of this story, but they do lose their central vision over time.
And one of the things that we have talked about, in fact, just recently, you should look up the show that we did. It's called Your Eyes, Your Vision, Your Health, and Hope. And one of the things we were just talking about is you stress the importance of getting a good diagnosis early because that's so important in manifesting a good outcome.
Absolutely. With macular degeneration, once the diagnosis is made, a good treatment plan is started so that the patients can protect themselves, protect their eyes. Our goal, macular degeneration, unfortunately, is a disease that we cannot cure yet. Macular degeneration progresses, and our job as physicians is to slow down the macular degeneration to the best of our abilities so that patients can preserve the vision that they have. In rare cases, we are able to bring some vision back, but it's always useful to start early, catch the diagnosis early, and basically start a treatment plan that can help protect the eyesight in the future.
Yeah, and that was really the point that we were really emphasizing in that particular program, was how important it is to keep things at as to toe the line because there are new treatments and things that are coming up all the time. So even something that couldn't be treated 5 years ago might be able to be treated now, and it same holds going forward. So we really want to talk about, if you're going to say now that somebody has a general understanding of macular degeneration, what are the updates and the things that excite you to give hope for people that may be suffering with that diagnosis?
So the first most important thing that we know about, or that we do currently with macular degeneration, especially the wet macular degeneration, are these injections that we give. We currently have 3 medications that we can use for macular degeneration, but there's few more that are coming down the pipeline. You know, as our armamentarium becomes bigger to be able to treat macular degeneration, we're able to then pick and choose the appropriate tool and apply it at the appropriate time to help slow down the disease processes. We're learning a lot about macular degeneration. You know, the injections first started about 10 years ago now.
Okay.
And over time, we have learned a lot. With millions of people worldwide getting these injections, we're learning not only how these drugs work and how it mitigates macular degeneration, but we're also learning how to use the drugs correctly. You know, if you look at the history of where we came from with macular degeneration, I remember when we first started giving injections, I was in my residency and fellowship, and these injections just came on the horizon, and we were giving injections only on an as-needed basis. Then in about 2010, 2011, there were these studies that were published that showed that we as physicians were under-treating patients with macular degeneration.
Okay.
When we waited to give shots to these patients, and when they bled, we allowed the disease to get worse enough that some patients lost vision by waiting. And so we, you know, very smart physicians came up with the idea of treating this disease in a new way. And what we started doing was we started treating the disease very actively, giving injections every few weeks, and then switching over to a preventative strategy where we then started giving maintenance injections to keep the disease from getting worse and keep the eye from bleeding. And you know, that's a very small change. That's not new technology, but it's the new application of an older technology that allowed us to offer people hope because we can now keep them from bleeding, and that's called the treat and extend protocol. So injections are the very first thing that patients with macular degeneration, wet macular degeneration, discuss with their physicians, and that's the newer technology with newer injections that are coming about. One of the sad parts about macular degeneration and these injections is the cost to the patient, and I don't mean financial cost. I mean the time. These patients have to come in every few weeks and every few months for injections. It adds a treatment burden to the patient. It adds the treatment burden to the physicians and to our healthcare system. So the future technologies that are coming around the corner are going to be geared towards not only treating the patient, but decreasing the treatment burden for these patients, which means drugs that can be extended, time release injections. There's a technology being investigated now where an injection can be placed in a reservoir that is placed around the eye, and it will time release the medicine in.
Wow.
So you only need to have it tanked up every few weeks or months. There's technologies that are going to be coming around that allow us to be able to catch these things early enough so that we have to give fewer shots with imaging technologies and things like that. Some of the other new things, you know, and we can discuss these in just a few minutes, but stem cells are a big thing that are coming in. There is biologic improvements that we're going to make with technology, and then there are technological improvements with nanotechnology that will apply to macular degeneration as well. So this is a very exciting time because amazing amount of research and resources are being poured into macular degeneration, just one condition, because it is such a huge financial impact for the individual patient, for our healthcare system, and for our nation.
Well, I was going to say, we talked about this in the show on hope, but really that has to be one of the most frightening things to face. And I think you quoted a survey or a statistic that said if a patient were to be given a choice, they could either lose their sight or have to recover from a heart attack. You know, this thing about sight is terribly important. And so one of the things that you explained also was that oftentimes when a patient comes in and you start to look at macular degeneration, you find there's cataracts involved as well. And so I was curious because as a typical person outside the medical field, we assume, well, you either have this or you have that. You don't necessarily assume that you would have all these things fighting at you at the same time. Does that, and particularly as we're talking about updates, how do you treat a patient when they come in with a multiple diagnosis like that?
So, macular degeneration, it's true. The full name is age-related macular degeneration.
Okay.
So most people carry the gene for macular degeneration, but it doesn't manifest itself till you get older.
Okay.
Well, one of the other changes that occurs in our eye as we get older is a formation of a cataract. So often I'll get patients who have macular degeneration who have also developed a cataract simultaneously. And it often comes down to these patients where they have to decide, well, which one do I do first? And there is a proper methodology. And as physicians, we make a decision with the cataract surgeons and the retina specialist. We make a decision as to which should take top priority. And a lot of that is based on a good eye exam. Once we examine the patient and we determine what the cause of their vision loss is, whatever the dominant cause is, that needs to be addressed first. Often it's the cataract, or it could be the macular degeneration. In general, just for the viewing audience, and none of you guys are asked to be physicians, but if there is any injury to the retina, or if there's any fluid or blood in the retina, that has to be treated first before the cataract is taken out. Rarely would you have to take the cataract out first before you treat macular degeneration. And that's because cataract surgery, although it doesn't make macular degeneration worse, people that have fluid in their eye from macular degeneration, that fluid can increase after cataract surgery. And so most physicians will treat the macular degeneration first before they treat cataracts. Now, having said that, one of the very interesting things, because of technology, our patients now have choices of what kind of lens they want in their eye. And we have these fancy lenses, they're called multifocal lenses. They are toric lenses. These cosmetic lenses, as they're considered, these lenses are given as a choice to the patient. And sometimes the patients don't know what is the correct lens to get. Because of cost with the technology, a lot of patients are spending money out of their pocket to pay for these cosmetic lenses. And one of the things that we do with our macular degeneration patients is, after a full exam, we advise them what is the appropriate lens for them. And I think that's very important for patients to understand that going into it, so that they're not disappointed at the end of the procedure where they've spent $5,000 of their money and they don't see any better.
Right.
So cataract surgery is very useful for macular degeneration patients, but it has to be properly evaluated in along with the macular degeneration to determine where in the treatment program it fits in.
Yeah, it's one of the things that keeps coming up as a theme through this over and over and over is get your eye exam in and really do a thorough job, because what you're talking about is things that I remember, because I think we spoke about it before, but Joe Steckler had his cataract surgery filmed there at the Eye Institute because he wanted viewers to understand, don't be afraid of the process. You have so much to gain by taking these steps and to get these things moving in the right direction. But as we continue on this theme of updates and things that are coming down the path, you mentioned stem cells. Now, I realize that's a buzzword, so most of us don't even really understand it other than we hear it and we get excited that it must mean something good is coming. Tell us a little bit about what that has to do with macular degeneration.
Perfect. So stem cells, Kerry, stem cells are basically cells of our body that are what they call pluripotential cells. That means that these cells have the ability to turn into any cell that it is chemically signaled to turn into. So a stem cell in the eye, given the right chemical signal, will turn into an eye cell, a retinal cell, a nerve cell. And if you can create new cells to replace the ones that are degenerating, then in theory, you can restore vision, because now these new cells will take over the function of the degenerating cells. And stem cells, as you said, they're used in everything from joint surgeries, they're being used in eyes, they're used in other organs. So stem cells are a very good source of new cells for patients. Now, when it comes to the eye, the cells of the eye go through something called the final differentiation pathway. That means that these nerve cells, once they become nerve cells, they cannot go back and become any other cell. Okay. So once these nerve cells are damaged, then they cannot be regenerated, okay, unless you use stem cells. Now, stem cells is a very, very amazing technology, but it's fraught with problems. One of the things that a lot of times patients don't understand with certain stem cells is that when you get a stem cell transplant, that is equivalent to getting any other organ transplant. That means that your immune system has to be suppressed so that these stem cells that you get are not rejected by your own immune system. So stem cells do have a lot of baggage that go with it. And some of the newer technologies, as we talk about modern technology, some of the newer things that we're striving towards is using a person's own stem cells to be able to replicate the cells that you need or grow the new cells that you need, and without using the immune system. So if it's your own body stem cells, then your immune system will not reject it, which means you don't need immunosuppression and the cost of those drugs and the side effects of those drugs. Right. So that is the holy grail of stem cell technology, to be able to get stem cells easily from one's own body and put them in the eye so that they can become eye cells. So we're not there yet, but there's lots of good work being done to take us to that point.
You know, which brings up a point is when you discuss things, people often run across news about things like stem cells, or they get excited, this cure has been discovered, and we, you know, every day, it's sad but true, we see things on the internet that say, you know, here, do this, or send us this money, we're having this clinical trial, or different things like that. How does a consumer know what's legitimate and what's not legitimate? I mean, how would they protect themselves if they're obviously wanting to take advantage of the hope that something could bring, but they want to not be taking advantage of in a fraudulent kind of way?
Right. And that's a very good question. And I will tell you a personal story about that, because this happened to one of my patients. I have a very nice young woman who is losing vision, and she researched on the internet and found a company that was doing stem cell technology work. And she contacted the company, and the company promised her vision by injecting her own stem cells in her eye. And the cost for that technology for her was around $21,000 to $22,000. So, you know, she was willing to empty her bank account and her savings to be able to get the hope of being able to see. And her mom contacted me, and I investigated that on her behalf. And what we found was that this was actually a scam. There was no real promise, no real good technology that was going to be applied for this patient. And she would have spent $21,000 of her own savings to be able to get the hope of being able to see. So I think, to answer your question, you know, stem cell technology is very good, but there's a couple of things we have to remember. If you're going to enroll in a clinical trial, you shouldn't have to pay to enroll in a clinical trial. If you are asked to pay money to enroll in a trial, that's a red flag. You should say, wait, stop. Because most good clinical trials will pay the participant, because they're the ones doing the research, and the company that's instituting the trial is the one that's going to benefit from that. The other thing that's important is talk to your doctors about it, right? You know, my patient and my patient's mother had enough confidence and enough comfort with me to ask me this question, and I'm glad that they did, because when we investigated, you know, we were able to save her from making a very big mistake, a financial mistake.
Well, that actually was going to be maybe a point I wanted to ask you about, is when you see something that you're not sure about, wouldn't it make sense to then call your call you or call the Eye Institute and say, listen, I'm reading this, is this right? And then you would be able to help steer them correctly so that they don't make that kind of mistake. Because I assume one of the things that, you know, the Eye Institute, you guys, I know certainly from the existence of Helping Seniors, you guys have been with us from the very first day that Joe Steckler founded the organization. But you guys really have a history of treating people here in Brevard County for years and years and years. And so you have their best interest at heart. And when somebody pulls, you know, it's going to be either something they see on an internet, find in some newspaper, and there's always going to be that but they should call and check, shouldn't they?
Absolutely. And I think this is very, very important because we can't believe everything we read on the internet.
Right.
And just as there are amazing new technologies that we learn about and amazing information out there that can help us, there's also bad stuff out there.
Yes.
And unfortunately, this specific person, this specific trial that she was going to pay into appeared legitimate in every way. And as physicians, we are in tune with some of the things that go behind the scenes.
Right.
And we have access to information and databases that a layperson may not. So I encourage anybody, if you are thinking about enrolling in a trial, if you don't think the information you heard is legitimate, ask your doctor. Your doctors are your best resources. I mean, as physicians, we're privileged to have a relationship of trust with our patients, and a patient should trust us to say, hey, should I go into this? And I will tell you that most doctors are honest and ethical, and they will tell you the truth, and they have their patient's best interest at heart.
Yeah, I would think so. Now, one of the other reasons to give your office a call is we were talking about this. There's a thing that you do says, "Will I go blind?" It's like a checklist. So it's a little bit like with the same thing. If we're going to stay ahead of the curve and not try to be as in front of things as we can, you said this is a neat checklist that's a place to begin with this. Tell us a little bit about what that is.
So one of the questions that I get asked almost every day, patients say, "Doctor, will I go blind?" And that is a very weighty statement. Will I go blind? This is something that people are very afraid of.
Of course.
And I thought about this, and what we have done is over the years I've accumulated information as to what it would take for somebody to go blind, and over time we've developed a checklist that a person can apply in their life and determine if they have the risk factors, if they have a natural propensity to have an eye disease that could affect them. And this ties in with all of the conversation we've been having, and that is that there's a little mnemonic that I've come up with, and I call it Carpe 2020. And basically it's an acronym that stands for C stands for catching symptoms early. You want to be able to catch your symptoms early, not ignore your symptoms. The A stands for awareness. You want to be aware. What are your risk factors? What is your family history? That's very important. It's interesting nowadays you hear these ads about these genealogy websites and 23andMe. So people have access to DNA information about their families.
Right.
So you have that access. So you should be aware. If there is a risk of cancer in your family, if there's a risk of macular degeneration in your family, you need to be aware. So being aware and being educated about it is very, very important in taking the next step. The R stands for getting referred early. I know that patients sometimes go see a doctor and they may have an issue that doctor can't fix. Then they need to ensure that they get referred early to the right specialist that can take care of that. Sometimes patients either choose not to go to a specialist, or sometimes the physician treating the patient may feel that, I'm comfortable managing this, and may not refer early enough. And as specialists, sometimes we have access to information because of our specialty meetings to new technologies and new medications that the general practitioner may not have access to. The P stands for prevention. I'm a huge believer in prevention. Preventing blindness because of what I treat every day, because of the nature of the diseases and the retina that I treat. A lot of the diseases and the damage to the eye are non-forgiving. And I always tell patients, if they're in a bad situation, could this have been prevented? Could we have done something earlier? And so I'm a big proponent of prevention. So the P stands for prevention, and the E stands for education. Education is critical. The very show that you do, you educate seniors about the things that they should be aware of. I think this forms that big category of how, of preventing problems. And this is part of our, will I go blind questionnaire.
Good.
And basically it makes people aware of their risk factors and a plan that they can create so that it's not so scary when they do get a diagnosis.
So let's say somebody is intrigued with that and they say, listen, I do want to look at that and see that. They should call your office, right?
Absolutely.
What's the number there?
It's 321-722-4443. And if you call our office, one of the nice operators will take your phone call, and you can mention that you saw this on the Helping Seniors website or the show. And and ask for the risk questionnaire, and we'll be happy to email it to you or send it to you.
Good. Say that number one more time. So
it's 321-722-4443.
And there's also a good website. It's cbetterbrevard.com.
Absolutely.
And the thing that we should all take away from our conversation today is there is a lot of hope to be had, but we have to get started on this process early.
Absolutely.
So the important thing is that somebody needs to get their eyes examined. And that's why you actually have a new program called Healthy Eye, Healthy Eye. And we just have just a moment, but it sounds really exciting. So I just want to have you talk just a moment about that.
So the Healthy Eye, it stands for Healthy Eye, Healthy Eye. And the reason we came up with that idea, that program, is because the eye is connected to the rest of the body. And we often think that the body is compartmentalized, right, when it is not. And the eye exam is often blown off by patients, or even sometimes by doctors, saying, oh, just an eye exam, go get it done. And you think that's an independent exam, when really the eye is a window into the whole body, and we're able to diagnose and catch diseases early in the process simply by doing a good comprehensive eye exam. I've had the fortune or the misfortune of catching patients with cancer, with tumors, with blood clots in the eye. So, a good, dilated, thorough, comprehensive eye examination can really save your life.
Wow. It's amazing when you think about that. There's just so much to all of that. Well, I really want to thank you, Dr. Vaishnav, for being here. And I want to encourage you, viewer, to go on the Helping Seniors website. It's helpingseniors.brevard.org, helpingseniors.brevard.org. Have a look. All you got to do is type in the word eye, E-Y-E, and you will see a list of shows that will be very, very relevant to the show that we've just talked about. So thank you again for joining us, and thank you, viewer, for watching us on the Helping Seniors television side.
Thank you for having me.
I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses, and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniors.brevard.org. Thanks so much for your help. It does make a difference.